This is Leo Vardarella, writer and reporter at Becker's Hospital Review. Today, I am pleased to be joined by leaders from NTT Data, MarkLogic, and CentraForce Health to discuss how they are all partnering to effectively manage data sources to create intelligent actions in healthcare. From NTT Data, we have Karen Wei and Dr. Suman D. They are global practice leads for health plan data and intelligence at NTT Data Services. From MarkLogic, we have Jim Sears, the Senior Director of Global Strategic Alliances, and Bill Fox, Global Strategy Officer, Healthcare and Life Sciences. And from CentraForce Health, we have Dr. Steve Newman. Steve is the Executive Chairman of CentraForce Health and the former Chief Operating Officer of Tenet Health System. Thanks for joining, everyone. Let's dive in. So first, how can health plans leverage data to inform their decision-making? Bill?
Thank you, Lee. That's a great question. And I think the answer to the question is that both payers and providers, they don't really just want to think about a question that they want to answer with data. They want to become data-driven organizations and really leverage all the data that they collect across their organizations and from sources across the ecosystem to really gain new insights, improve outcomes, cut operational costs, et cetera. The challenge that they face is that traditional data architectures that they're sitting on make this very hard. And healthcare, of course, we're always, so to speak, changing the engine. The plane is flying. We can't just stop treating patients and servicing insurers while we sort of upgrade to become digital organizations. So what's really needed is a platform that can bring all of the organization's data together with new emerging sources of data, operationalize all that data so that they can really transform into this new kind of agile, data-driven healthcare enterprises. And that way they can use their data to inform their answers to all their questions.
Great. Thank you so much. So, Dr. Newman, what is the impact of all this data to healthcare in general?
Well, that's a good question, Leo. We at CentraForce Health believe that the use of non-traditional data, such as that self-reported health attitudes and behaviors, are a powerful and actionable adjunct to traditional encounter data coming from payers' claims as well as providers' electronic health records. The largest and daunting challenge looking forward for payers and providers will be the assessment of rising risk in populations that seem healthy. Utilizing NTT Data's business insights engine, payers and providers can obtain a 360-degree view of the member or patient, whether they're inside or outside of the care setting. As a valued partner of NTT Data, CentraForce Health provides users of the Business Insights engine data and actionable insights that prove clinical outcomes while at the same time driving down the cost of care.
Interesting. Thank you, Dr. Newman. So how can artificial intelligence be utilized in these efforts, Dr. Suman?
So that's a great question, Leo, again. And we have started witnessing that artificial intelligence is going more and more into the business stream for any organization, and especially healthcare organization for sure. And for a recent statistics coming from IDC FutureScape, we will see in 2019, 40% of digital transformation initiatives will be supported by cognitive and AI capabilities, providing timely critical insights for new operating and monetization models. So healthcare organizations now seriously need to rethink on their traditional approach of storing and managing their big data and consider moving to a next generation data management system, just like the NTT Data Business Insights engine, which is a multimodal data management platform and becomes a perfect answer to this need. The potential for such a data management system is definitely going to support a wide range of AI capabilities that organizations really need in order to make their business transformation, be it from autonomous robotics to virtual agent adoption, to making imaging analytics for incidental findings, or creating risk stratification and risk corridor analysis like machine learning models, or even predicting the service utilization for the members or the patients who are going to be, high cost, high risk for ER and IP utilization, as well as understanding their sentiment in order to make a proper branding, as well as bringing them back into the business by proper expectation management, and then looking also into the financial aspect like the fraud, waste, abuse detection. There are much more such use cases which can be imagined and executed over such a niche data management platform, which brings in data from multiple sources and of multiple types for various formats in a much more aggregated fashion, which is easy to manage and easy to be leveraged. The future of artificial intelligence hinges on the continued development of such data management technology and platform, and it can definitely be a boon for healthcare organizations to leverage and utilize the growing variance of data set much more with ease on such technique.
Thank you very much. So, Jim, what is the biggest misconception health plans have about big data?
Leo, I think the list could get pretty long, but if I were to try to distill this, I would say that most people think it's too hard to get a 360-degree real-time view of consumers, patients, and physicians. And why do they think big data is daunting? I think it's really because the volume, the velocity, and the variability of the data does not easily integrate well together using legacy technologies that Bill referenced, or even more modern data lake technologies. As we all know, an onerous amount of time is spent modeling the data, which, by the way, is constantly changing. You end up with a years-long project with questionable ROI, and this simply reinforces that misconception that big data is too difficult. Today, MarkLogic is working with NTT Data, much like we work with healthcare.gov, to break down the data silos and developing with incredible velocity repeatable solutions for the healthcare industry that provide real-time, 360-degree insights that were previously only a vision. It's really about running the business in an agile manner versus simply observing the business, which was where I think a lot of these big data projects end up. It's also worth noting that as IoT data would include wearables and get incorporated into the healthcare equation, health plans will now have the ability to quickly analyze these data sets at the patient level and make real-time recommendations that can not only save lives, but provide valuable macro insights for future care for the plan's membership.
Interesting. So, Karen, what kinds of solutions does NTT Data offer health plans looking to manage data?
Well, my colleagues on this panel have kind of given some hints up front, Leo. We have a new solution that we've been working on for the past year called the Business Insights Engine. And as was mentioned, it brings together data from multiple different data sources, multimodal, as Dr. Suman mentioned, where we can have structured, unstructured, semi-structured, graphical, spatial, any kind of data, the IoT wearables data, bringing that in as it is. So again, no upfront modeling, as Jim mentioned, to have that data stored, and then we go through a process of what's called harmonization, where we create a single canonical model of all of that data. So it's all in one repository, and it's all in one sort of, I don't want to call it structure, but in one format, so that you can go after that data with advanced analytics, like AI, like machine learning, to create that truly 360-degree view of a member or a provider or a claim itself. But you can also create that view with the different lenses through which an end user might look. So, for example, a provider might look at a patient/member slightly differently than a health plan, and very differently than the employer group that member belongs to would look at it. In this environment, in the Business Insights Engine, we have constructed the solution in such a manner that it doesn't matter which lens you're looking through, you'll be able to have that information, and with the near real-time capabilities, you'll be able to be much more proactive in either outreaching to the member or intervening in some cases with the member so that as to prevent catastrophic issues, ER visits, hospitalizations, and potentially even preventing say, a heart attack or something, by being able to have that near real time and react proactively. That seems like a misnomer, but it actually happens for that member so that their outcome is greatly improved, that they're not spending weeks, days, or months in the hospital, that they're able to avoid that completely and have better health moving forward. We are using the FHIR HL7 data model for the canonical model, which means we're moving much more towards interoperability. It's something that CMS is looking for, the health plans, the payers, healthcare in general is really striving towards that interoperability standard, and that's the mechanism by which we're supporting that. We also are supporting the advanced analytics, as I mentioned before, being able to create those next best actions by having all of this information, including the social determinants of health that CentraForce brings to the table, information about a member's transportation risk or their food risk. Are they economically at risk? Education, all of those different factors that CentraForce Health has been able to create and feed into our system at a member level allows us to have much more holistic pictures, that true 360 degree. Providers, payers, pharma companies today, they don't have access to member behavior. Bringing together the social determinant of health data with the data sources that all of these entities can bring to the table is really what's going to create that 360 degree view and lead to the better information about how can a member be influenced for better behavior and therefore better health. We're able to do that with this platform. The Insights Engine is more economical for a health plan because it's an as-a-service solution, meaning it's cloud-based. It is HIPAA compliant so that there's no issue relative to security. We have security down to the element level so that we can mask or redact information that needs to be restricted for use. We've really taken all of the big components that health plans and providers deal with today, either in the traditional enterprise data warehouse environment or in a big data environment, and we've encapsulated that into our overall platform. And we're really, really excited about taking this out to market. We've already sold this to existing health plans, and we're looking forward to moving it out further.
Wow, sounds great. Thank you, Karen, Dr. Suman, Jim, Bill, and Dr. Newman for your time and insight. And thanks to NTT Data for sponsoring our podcast. To learn more about NTT Data, please visit us.nttdata.com/en. If you have any feedback on this program or requests for future podcast topics, please email me at lvardarella@beckershealthcare.com. And please make sure to regularly visit Becker's Hospital Review at www.beckershospitalreview.com for the latest business, legal, and clinical news and guidance for hospitals and health systems. Thank you for joining us.